Nassau County is suing more than 24 opioid manufacturers, distributors, and physicians to recoup the millions of dollars spent to combat the opioid epidemic it says they provoked. 8 other New York State counties have filed similar lawsuits.
Communities and citizens across our country are currently dealing with the worst drug crisis in American history.
President Trump last month declared the opioid crisis a national public health emergency. 41 states have opened investigations into pharmaceutical companies' fraudulent marketing of the drugs. The Nassau case's lead attorney Salvatore Badalla says manufacturers and doctors are enriched by the lucrative opioid market.
Unfortunately, with these manufacturers and defendants, what we have to do is kind of hit them where it hurts, in the pockets, because they're going to continue to make money.
Badalla says the county was forced to spend millions on Narcan training, police overtime, and health insurance to contain and reverse the damage. And that's only the tip of the iceberg.
I think the numbers we see now are large, but I think they're underreported. I think as more people come forward, you're going to see how really this is a much bigger issue.
Across Long Island, a record 500 people died from drug overdoses last year. Nassau County's toll rose to 190. The county's website states that prescription opioids cause the most overdoses.
I was on a crane accident in Manhattan, and that's when it really took off. They put me on 30 milligram oxys, and I couldn't get off. I couldn't stop. I had to commit crimes just to get them.
Retired Nassau plumber Patrick Martino is a recovering opioid addict who now helps counsel others. He says his 2 doctors turned a blind eye on his addiction and helped him access more drugs.
I basically manipulated them into selling me prescriptions, and I just kept doing more and more, getting prescriptions under my mother's name, my sister's name, a friend's name.
Martino says he dealt with severe withdrawals whenever he tried to stop taking the drugs.
The sickness involved with it is so brutal that you want to kill yourself, so you do anything to keep getting them.
Stony Brook School of Pharmacy assistant clinical professor Dr. Amanda Iloma says physical addiction to opioids follows a basic formula.
There's this increase or surge in dopamine in this reward pathway. And every time that it's increasing, your body feels good, feels that euphoric type of feeling, and it's reinforcing this type of behavior.
Iloma says opioid prescriptions should be carefully monitored and only used as a last resort for treatment.
Although opioids do provide, relatively good pain relief, it's important to utilize other options first.
With chronic opioid use, people will eventually need higher and higher doses of the drug to get the same effect. This is where addiction starts.
Often they didn't have drug problems until they suffered an injury and they were put on pain medication.
Chair of the Nassau County Prescription Drug Misuse and Abuse Prevention Committee, Eden Lakin, says Nassau was the first county in the state to make Narcan training for civilians in 2012. Narcan is a nasal spray used to immediately counter the effects of an opioid overdose.
Nassau County has been a model in so many areas.
The county also introduced a support group where people learn about Vivitrol, a drug that diminishes withdrawal symptoms. However, the lawsuit states that a lot of Nassau's initiatives to prevent opioid use and to halt addiction is costing the county. The initial proceedings will take place here at the New York State Supreme Court in Central Islip. After this, each county will take their trials back into their individual courts. Nassau says it's working with experts to determine how much they had to spend during the opioid epidemic, but says the numbers are well into the millions of dollars. It is expected that the defendants will try to file a motion to dismiss the case. For Stony Brook News, I'm Jacob Lukowitz.